Hello everyone, it's Eva from Sunway Specialist Center, Damansara. Rhinoplasty, commonly known as nose job, is a surgical procedure that reshapes or repairs the nose. It can be performed for cosmetic reasons to enhance the appearance of the nose or functional reasons to improve breathing or correct structural issues. Rhinoplasty aims to create a harmonious and functional nose that suits patients' facial features and needs. Now, let's dive deeper into the world of rhinoplasty with our specialists, Dr. James and Dr. Eugene, who will be sharing their insights and expertise on this transformative procedure. Hi Dr. James, hi Dr. Eugene.
Hello.
Hi.
Why do most patients request rhinoplasty?
Most of our patients come here because they want their nose to look better. For example, to make their nose bridge a bit higher, to reduce a hump, make their tip of the nose slightly smaller, or to straighten the nose. At the same time, we have a lot of patients who come to us because of breathing issues as well. And because we are ENT surgeons, we know both the inside and outside of the nose very well. And therefore, when it comes to rhinoplasty, we will be able to help your nose look and breathe better as well.
What symptoms do patients have that need functional rhinoplasty?
Okay, so patients come to us for functional rhinoplasty if they have a problem such as nose block. So there are a few things that can cause the nose to be blocked, such as a deviated nose, a nose that is not straight, a deviated septum, and that blocks the breathing. Mainly when it comes to functional rhinoplasty, we're trying to correct that breathing to help reduce the block so that patients can sleep better, reduce snoring, and improve their performance in sports as well. So there are a lot of benefits of doing a functional rhinoplasty.
How do rhinoplasty techniques differ for Asians and Westerners?
So for Asian patients, most of them want a smaller alar, more refined tip, and to make the nose bridge a bit higher. Whereas for the Western patients, usually they have a nose hump and they want to make it smaller. In terms of anatomical differences, Asian noses usually have thicker skin and weaker cartilage. So a lot of the times they require an extra graft to achieve the desired look. So when we see patients from different backgrounds, we'll then tailor our approach to make sure that their outcome will be very natural and harmonious with the rest of their features according to their background.
What happens during a rhinoplasty consultation?
In a rhinoplasty consultation, first we would like to know what are your concerns and what are your goals. We would also take some photographs. We might morph the pictures, and if it's a revision case, we would also look at your scans to know what you did previously. We would also do an endoscopic examination, look into your nose, so we could create a personalized plan to achieve what you want.
What materials are used in rhinoplasty, and what are the pros and cons?
So rib cartilage harvest will make the operation time a bit longer, and it will leave you a scar, but usually it is very well hidden. Another commonly used material is silicone graft. This can usually be very precisely sculpted, and it is very readily available, and it's usually cheaper and quicker to perform. However, using this material does come with a bit more complications. For example, it can be infected, it can migrate, and it can be extruded from the body. So when we see you for rhinoplasty consultation, we will discuss all this with you, and we will pick the best one to fit what you want as the outcome of the operation.
How long is recovery after rhinoplasty, and what care is needed?
Recovery usually takes about 1 to 2 weeks. The final results may take about 6 to 12 months because of the healing and swelling. After surgery, usually we would ask patients to sleep with their head elevated. They would need to clean their nose, their wound. We would try to avoid any strenuous activity that might increase risk of bleeding and swelling. They would usually need to come back for follow-up also. And during the follow-up, we might help them change their bandage on their nose. They might have to clean their nose a little bit. So come for follow-up because that would ensure an optimal result for the surgery.
Thank you for joining us today. We hope this information has been helpful and insightful. If you have any questions or would like to book an appointment, please don't hesitate to call us. We'll see you soon. Bye!